What are oncogenes in lung cancer oral therapy? Have you ever wondered how certain genes can influence the way lung cancer develops and is treated? Oncogenes are mutated or abnormally expressed genes that play a significant role in the growth and survival of cancer cells, including those in lung cancer. In particular, non-small cell lung cancer, which is the most common type, is often driven by specific oncogenes such as Epidermal Growth Factor Receptor, Anaplastic Lymphoma Kinase, ROS1, and RET. These oncogenes produce abnormal proteins that encourage uncontrolled cell division and tumor growth. Oral therapies for lung cancer are designed to target these oncogene-driven pathways. One of the main types of drugs used in this context is called tyrosine kinase inhibitors. These are small molecules taken by mouth that specifically inhibit the activity of the abnormal proteins produced by oncogenes. By doing this, they block the signals that promote cancer cell growth and survival. A key concept in this area is something called oncogene addiction. Many lung cancers become addicted to the signaling from a single oncogene. This means that the cancer cells relying heavily on that oncogene for their survival. Because of this dependency, targeted oral therapies can be highly effective in patients whose tumors have specific oncogene mutations or rearrangements. Let's look at some common oncogenes in lung cancer. Mutations in the epidermal growth factor receptor are quite prevalent and can be targeted by specific drugs known as epidermal growth factor receptor tyrosine kinase inhibitors, like osimertinib. This particular drug is effective even against certain resistance mutations. Another important oncogene is Anaplastic Lymphoma Kinase. Gene rearrangements in this oncogene produce abnormal proteins that can be inhibited by oral medications such as alectinib, brigatinib, and lorlatinib. Additionally, ROS1 and RET gene fusions are other oncogenic drivers that can be targeted by oral inhibitors like selpercatinib, which has shown significant activity with manageable side effects. The convenience of oral targeted therapies cannot be overstated. These drugs are taken by mouth and work by inhibiting the tyrosine kinase enzymes encoded by oncogenes. This effectively blocks the cancer-promoting signals, offering a more convenient option compared to intravenous chemotherapy, which can be more taxing on patients. However, resistance to these oral targeted therapies can develop over time due to secondary mutations in oncogenes. For example, the epidermal growth factor receptor T790M mutation can emerge. This is why molecular testing of tumor tissue or circulating tumor DNA is essential before and during treatment. It helps guide therapy choices and detect any resistance mutations. The clinical benefits of oral oncogene-targeted therapies are impressive. They have been shown to improve progression-free survival, response rates, and overall quality of life for patients with oncogene-driven lung cancers compared to traditional chemotherapy. Plus, they generally come with fewer severe side effects. In summary, oncogenes in lung cancer are mutated genes that drive tumor growth, and oral therapies are designed to inhibit their activity. These targeted treatments have transformed the landscape of lung cancer treatment, providing effective and personalized options that improve patient outcomes and lung health. However, it is crucial to continue monitoring and personalizing care to optimize therapy and manage any resistance that may develop. Always consult healthcare professionals for personalized medical advice.